Hello and welcome. You're watching Head to Head on UATV. I'm Oles Garjuk. We all know that consequences of war are horrific, from hundreds of destroyed towns and villages to millions of damaged lives. 3 years ago, Ukraine was not ready to face such a challenge. But is that still the case? To answer these questions, we are joined in the studio by Quincy Moore. He is Program Director of CETA in Ukraine. Hello and thank you for joining us.
Hello, thank you.
Mr. Moore, could you tell us all about psychological aid provided to victims of war in Ukraine?
So Ukraine, especially because of the conflict, has seen an increase in challenges related to mental health and psychosocial issues. This is especially important with those in the region of the conflict and with soldiers and veterans' families. As a result, there's been some building up of different programs by various international partners, and the CETA program is one of those. And
CETA program is the program that you're working in Ukraine?
Yes, CETA program is the program that from Johns Hopkins University that we're implementing here in partnership with Kiev Mohila Academy.
Mm-hmm. But it's being implemented not only in Ukraine,
Yeah.
It's much wider, right?
Yeah, so our program is also being implemented currently in Zambia, in Burma, Myanmar region, and also in Papua New Guinea. And in the past, it's also been used in Iraq, in the U.S., and other places.
So this is some special psychological program to to heal the society after some kind of conflict, or?
It's more of a approach that uses already proven psychological or tools in mental health. It's built off cognitive behavioral therapy, which is a very evidence-based approach that's been researched for many years around the world. Cognitive behavioral therapy hasn't gotten very big in Ukraine yet. There's not that many people trained in it, and there's only, I believe, one school that trains psychologists in cognitive behavioral therapy. But so CETA is a way of training community workers to use some of these cognitive behavioral skills to treat people who have been affected by the war.
Okay, so CETA is training psychologists in Ukraine.
Yeah, actually not only psychologists, we also train social workers and just people who have access to the communities that are most in need. So we have veterans, we have veterans' family members, we have IDPs, and we also have, some of them are psychologists.
So veterans are also helping?
Yeah, we also have some psychologists. We train some veterans in providing CETA, because these are people that are part of the communities that need help. And this is the CETA program was developed, and originally part of it was developed for use in countries where they don't even have the trained psychologists. Ukraine does have trained psychologists, so we're kind of a step ahead there, in that mental health services are available.
When this program was launched in Ukraine, and how successful is it so far?
Yeah, so we started the very initial steps in 2015, but those were mostly interviewing people, figuring out where the needs were, figuring out who we could partner with, and how the program would work, and whether CETA was even worth trying in Ukraine. Maybe the community-level mental health services here were adequate enough as were. But what we found during those interviews was there was a kind of a gap. In Ukraine, there's a large institutionalized mental health system, so people can go to psychiatric hospitals, but at the community level, there wasn't as many resources for people. And for very obvious reasons, not everyone needs to or wants to or should go to a psychiatric hospital. They should be able to access care that they just go to and then they come home from once a week or however often they need to, but it doesn't involve staying in a hospital. So we found this need, and then we started training counselors working with our partners. And then just in January, we started kind of enrolling clients in this project.
And by this time, how many clients?
By this time, we have about 150 people who are part of the project. And there's been over 900 individual counseling sessions.
Wow. That's a good start, I would say.
Yeah, it's a good start, but our goal is more. So in order to get enough data, we were hoping to get over 350 clients. So we still need more.
Well, you probably have noticed that in Ukraine we have this kind of psychological aid is not very much appreciated just because people are afraid to go to the psychologist because they misunderstand psychology with the psychiatry sometimes.
Yeah.
I don't know, have you noticed this issue in Ukraine? But if you have noticed this, how does CETA deal with these kind of cases?
Yeah.
When people just refuse because it's humiliating them to go to the psychologist.
Yeah, I think that's a very important issue, and it's worldwide, not only in Ukraine. There's a lot of stigma around mental health. And
but abroad people even like they used to pay to go to this psychologist and to get the treatment because they like to talk to the psychologist and then they just enjoy the result. And here it's still a bit stuck in past.
Yeah, so globally there's a beginning to be more accepted and more attention paid to the importance of mental health and a little less stigma in places like in the U.S., some places there's less stigma about seeing a therapist or a psychologist. And yes, in Ukraine, there's still a lot of stigma and fear around seeking mental health services, which is really a shame. We've found that a large part of that is due to the past. In the Soviet era especially, it was very focused on institutionalizing people. So if someone had a problem, they went and they sought help at a psychiatric hospital, then they'd just sometimes be stuck in a psychiatric institution for years or who knows, and just medicated. And that's scary. Like, that's not the proper approach for a lot of mental health things like anxiety and depression that are very prevalent in the world and in Ukraine. So CETA the way that CETA is dealing with this is trying to bring it down to the community level. You don't have to go to a psychiatrist. You don't have to go to a hospital. Our counselors are meeting with clients wherever they can, maybe in their private office or at some community center in a private room or something. So that helps reduce stigma. And then CETA is it's teaching people skills for adapting and dealing with whatever stresses and anxieties or depressive thoughts they may be having. It's not a medication. It's not a treatment that has to last forever. CETA lasts anywhere between 5 and 12 weeks normally, and it teaches people skills on how they can cope with what they've experienced. So, and we're hoping that through more education and more exposure to these ideas that people become more comfortable with it.
And could you also focus on some features how CETA is actually processing and what CETA is it working? Is it free of charge? So what are the conditions?
Yeah, so CETA is free and it's being implemented in Ukraine as a program, but also as a trial in order to really test the efficiency or the effectiveness of it in the Ukrainian context. Because some programs are tested. Not all mental health programs are even tested because for various reasons. And for us, it's really important to have an evidence-based approach. And even though an approach might prove effective in one context, in a different country, where there's different norms and different cultures, it might not be effective. So that's why we're adapting CETA to the Ukrainian context, testing it here. And so to get to your question, when a client comes to us, we have a baseline procedure where they fill in a lot of information anonymously. Everything's anonymous.
So it's anonymous or confidential? Do they mention their name?
They talk with their counselor about their name, but all the data that we're collecting is not attached to their name.
Okay, so that's anonymous.
Yeah. So for the baseline information, we ask them a series of questions about different things they've experienced, how they're feeling, and how this is impacting their lives. And then from that, we determine whether they're eligible for the study. Eligibility, the groups of people that are eligible are IDPs, veterans, veteran family members, and some volunteers who have directly experienced the conflict.
Okay.
And then...
In what cities is it implemented? Yeah.
Very good question. We're currently working in Kyiv, Zaporizhia, and Kharkiv. So we have counselors in all three of those cities. And yeah.
When I was preparing for this interview, I looked through your website, through the website of CETA, and I got struck by the statistics that 1 out of 4 veterans of the ATO needs the psychological aid in Ukraine. So basically, it is a huge need here in the country. How do you promote CETA, and what reactions do you see from the people?
Well, promoting CETA is an ongoing effort. We've been working closely with other organizations, both governmental and non-governmental, social services, and then other organizations that work with IDPs or veterans, trying to partner with them so they know about our services. So if some of the people that they work with need some mental health services, they can refer them to us. We're also doing direct outreach. We have counselors who work with these populations who help bring in clients and spreading the word however we can. We have posters you may see around town, leaflets that we're trying to leave places.
Can anyone join the list of counselors?
The list of counselors is set right now for this study. We had to get them all trained in preparation to gather all the data. So right now we have 31 counselors across our 3 cities, but we are looking for to scale this up afterwards if it proves effective. And I think there's a lot of opportunities for that.
And if somebody wants to become a client of CETA, what is the process to get this treatment?
Okay, very good question. So they can go to our website or call us directly. And after they contact us, we will reach out with them. On the website, there's a place where they can leave their contact information and we'll call them back, or they can call us directly. And we'll reach out to them to set up a baseline, which is the process I was telling you about before. And then after the baseline, they're either randomized to the treatment arm or the control arm. Because this is a research study testing the effectiveness in Ukraine, we have to have a comparison group. And the control group is a smaller group, and they still receive treatment. That's very important. These people will receive treatment, they just have to wait a little bit. And this is also, someone's going to have to wait because there's more people that need treatment than we have room to offer counselors. The majority of people go to the treatment group, and they will be assigned to a counselor and meet with these counselors usually once a week for between 5 to 12 weeks. And then after that, we follow up with them every month up until the 6-month mark to just determine and see the lasting effects of this program and make sure that our clients are still doing well.
Could you give us some examples of maybe, I don't know, the most emotional story from your experience or from experience of your colleagues?
Oh, there's so many just heart-wrenching stories that our counselors are hearing from IDPs and veterans that have experienced very traumatic things in the conflict. One short story that just stood out to me was there was a woman who who someone knew might need CETA help and talked to. And then she agreed, but she was very, very depressed and couldn't even leave her house. And so luckily, one of our counselors lived fairly close by and was able to go to her house and provide the first sessions. And after a few sessions, the woman was feeling better and could come and meet the counselor at our counselor's office. And then by the time CETA finished, this woman was feeling a lot better and was able to go like on a little trip with some of her friends. And so, I mean, it's easy to overlook the importance of mental health. It's like, oh, you're feeling depressed and you're having a bad day, or maybe you can't think, but like think straight, or you keep on getting distracted. But these can have serious effects on people's lives and even affect their ability to do their normal daily work or like take care of themselves.
Of course.
And so we have numerous stories where CETA's helped people kind of overcome these symptoms and get to a place where they can function better again and go on and live a happier life.
Well, personally, I think that you're doing really a good job, and I admire these efforts that you and your colleagues are putting in order to heal Ukrainian society, and thank you so much for this conversation.
Thank you.
That was Quincy Moore, Program Director of CETA in Ukraine. Thank you for watching Head to Head. I'm Alex Gerjuk. Goodbye.